Now, 2020 taught us more than ever before that health is the biggest wealth. There are big expectations that there will be a quantum jump in the health sector allocations in the union budget. But if the union government is going to fund India's vaccination drive, what is left? Asks NDTV's Uma Sudhir.
India's ambitious COVID vaccine program is expected to not just keep the pandemic at bay, it is also expected to revive the economy. But the cost of vaccinating even half the population at 400 rupees per person adds up to 27,000 crore rupees. That is 40% of what India spent on its health allocation in the budget last year. Finance Minister Nirmala Sitharaman has to find the money for vaccines and much more in the union health budget, with the economic survey pointing out that a health crisis can turn into an economic and social crisis too.
Last year we had about 1.3% approximately allotted to healthcare. Now because of this COVID effect, I am sure whole of the population and even political circles have understood that we have to have more resources for the healthcare.
At least minimum 8 to 10% we should build. What we have 1.3% today should increase 8 to 10%.
Experts point out that health sector allocation should be seen as investment rather than expenditure. And government funds should prioritize primary and secondary health care, sanitation and improvement of social sector, since that would take care of 70% of healthcare requirements of the population.
If the budget is spent most on prevention of the diseases, like primary health care centers, this and that would be, will be much more than the tertiary care. And tertiary care mostly now also 70-80% is taken care by the private sector.
And this is the private health sector prescription to boost investment.
So if they can give a 5 years holiday for all the private health care in the beginning, and second important thing, the taxes, especially in the 5-6 years, either it may be income tax, whether it may be GST, whether it may be an import tax, more and more private healthcare people will come into the picture.
The economic survey points out that India has the highest out-of-pocket expenditure on healthcare. So innovation is needed to push for universal insurance, so healthcare expenditure won't become an unexpected emergency.
Let the private people, all the public should pay 25% so that they will know what is the significance of this health. So once the insurance comes, the profitability and the generation of the private healthcare will also improve.
An area of opportunity for India is telemedicine and revival of medical tourism that was growing at 18% and took a hit last year. In Hyderabad with camera person Nagaraju, Uma Sudhir, NDTV.